After surgery for a mastectomy, with reconstruction or without reconstruction, in that early phase from surgery to 2 weeks, we want to make sure we really protect our surgical area and our drains. So typically after surgery, most people will have 2 to 4 drains coming out here from the sides of your breast, and they're usually attached to your bra, or people will wear an apron. We want to make sure we let those drains do their job, and their job is to collect fluid, so we decrease our chances of having any complications. So we want to make sure we don't overstress this area so those drains aren't able to collect the fluid. So one really good things we want to start with is we want to make sure we're getting breathing, which is going to help get some pumping of our lymph vessels. We have some big lymph vessels here in our abdomen that will allow us to keep our diaphragm moving, which runs underneath our rib cage. Keep that moving and keep that kicking in. Breathing will allow some rib expansion, which should help take some pressure off of the ribs here and into our sternum after surgery. And then we also want to get some muscle pumping to help with swelling and any fluid retention. So we can start lying on our back. Usually a wedge pillow is where most people after surgery will feel most comfortable, or in a recliner. You can lay on back, make sure your head is supported. And we want to find just a comfortable position. And to get a good diaphragmatic breath, our diaphragm runs, like I said, right here underneath our rib cage. So you can place your hands from that front of your hip, right on that hip bone, just gives you a nice little target. And then place it along those lateral ribs, and you should be able to feel the front here, the diaphragm. We're going to look for some rib expansion here coming out to the sides. And then we're going to also pay attention to feeling some back body expansion. So we want to think of our back slightly pushing down as we breathe versus arching up and away from the floor. So I'm going to place my pinky on that front hip bone just so I have a nice little landmark, give myself some feedback along those lateral ribs, and then my thumb is here into the front at that lower rib level. So as I take a big breath in, I'm going to take an inhale and an exhale. I should feel my belly expanding, my ribs expanding, and I should feel my back body expanding. So we're looking for that nice 360 expansion of those areas. So I'm going to take a breath in, and then as I exhale, you want to think of really trying to expel all that air out, and before you take another big breath in. It should be nice and slow and controlled when I go in from my inhale to my exhale. Then, and usually 2 to 5 minutes is great for some good diaphragmatic or belly breathing, 360 breathing. I can get some nice ankle pumps to get some of those lymph vessels kicking in, using my muscles to help create a pump. Good. Tightening the front of my leg, getting nice quad sets, holding for about 5 seconds, and then relaxing. And then doing the same thing with my glutes. Nice squeeze with my butt, and relaxing, squeeze, and relax. And then we might as well get our core kicking in. Since we're not able to do higher level exercises right after surgery, we can at least get some activation of the important muscles here. So if we think of finding our hip bone here, you want to envision those hip bones coming together, drawing them together, and relaxing. Breathing out as I tighten those muscles, and then relaxing, and you should feel a muscle activating just on the inside of that hip bone. And then I'm inhaling as I relax. Big inhale, and then exhale as I tighten those muscles. And then relaxing. Usually after maybe 4 or 5 days, it might feel comfortable to start just doing some really, really light range of motion. That's what I found for myself. So to make a shorter lever arm and make it easier for myself, I just placed my fingertips on my shoulders. And I just started with a super tiny little motion, just to keep a little bit of movement. And I found that felt comfortable for myself right after my surgery. So really slow little teeny arc here coming up. And then you can do the same thing coming out to the side, just in a really small range of motion.